Hey everyone, welcome to The Explainer. Today we're doing something really practical. We are opening up what I like to call the ultimate safe medicine cabinet. We're exploring exactly what relief options are secure for expectant mothers who are navigating the beautiful, but let's be honest, sometimes very uncomfortable journey of pregnancy. Now, pregnancy brings incredible changes to the body, but it also brings a whole host of everyday ailments that you suddenly have to treat with extra caution.
You know the feeling, right? It's a common, frustrating struggle. You're pregnant, you suddenly get hit with a fever or debilitating gas or a stiff body ache, and it hits you, wait, I literally can't just pop my usual pills anymore. You're suddenly left wondering what is actually safe to take for you and your baby. It can be a highly anxious moment for any expecting mother.
So here is the agenda for our safe medicine cabinet today. We'll be looking at 1. Pain and fever treatment, 2. Safe antibiotics, 3. Relief from gas and constipation, 4. Solutions for allergy and vomiting, and finally, 5. High blood pressure control.
All right, let's jump right into section 1, pain and fever treatment.
So if you're looking at your primary options, Calpol 500, which is essentially just paracetamol, is your absolutely rock-solid, incredibly safe go-to for a standard fever. It's a household name for a reason, right? It's widely considered super secure for pregnant women, usually taken in a standard 500 milligram dose. But what if you've got a fever that brings along that awful, severe body stiffness and aching? Well, that's where Ibugesic Plus comes into play. It actually combines ibuprofen with paracetamol to knock out those tougher body aches. The big takeaway for both of these, though, is that they are typically taken in low doses, usually just twice a day, just to ensure maximum safety.
Moving along to section 2, safe antibiotics in pregnancy. First up on this shelf, we have MUX, powered by its active salt, amoxicillin. It is honestly fantastic for treating eye, ear, mouth, lung, and even urinary tract infections, and it's given in a low 250 milligram dose. Next to it is erythrocin, which uses erythromycin as its active ingredient, serving as a really trusted standard alternative. And finally, we've got cefixime at 200 milligrams, which specifically targets throat, eye, and intestinal issues. Now, you might be noticing a pattern here. They are all recommended at lower dosages and are generally just taken twice a day. This is absolutely crucial because it ensures the infection is fought off effectively without totally overloading the mother's system.
Okay, next up is section 3, relief from gas and constipation.
For that wildly uncomfortable bubbling stomach gas, Axaloc 150, which uses ranitidine, and Pantop 40, which uses pantoprazole, are excellent, highly safe options. They give you rapid relief, and what's really interesting is actually how they are taken. To get the best results, you usually want to take these on an empty stomach, twice a day. Basically, they calm the stomach acid down before it has a chance to turn into a bloated, painful problem.
Now pay attention to this one because it's a major warning. While antacids are everywhere, you absolutely have to read the labels. Plain omeprazole, often sold under the brand name Omi, is completely safe for pregnant women. But, and this is a big but, you must absolutely avoid any combinations that contain domperidone. Domperidone is simply not considered safe during pregnancy. So seriously, stick to the plain omeprazole to settle that acidity without taking on any unnecessary risks.
Before we get into the remedies for our next issue, we kind of need to accurately define constipation in this specific context, because let's be real, it's way more than just a minor inconvenience here. It's a condition where stool does not pass easily, leading to severe stomach bloating, cramping, and just awful overall discomfort. You really need to identify if this specific type of bloating and lack of bowel movement is exactly what you are dealing with so you can treat it the right way.
So, to relieve that painful bloating, let's look at the actual solutions. Loose and smooth syrups, which are powered by their respective active salts, lactulose and docusate, are completely safe, low-dose liquids. The great thing is, they aren't harsh stimulants. Instead, they just help facilitate comfortable bowel movements naturally. You generally just take a tiny 5 milliliter dose twice a day. Simple, effective, and most importantly, pregnancy safe.
All right, section 4, solution for allergy and vomiting.
If a sudden skin rash or an unexpected allergy just flares up out of literally nowhere, you actually have two great options. Both Avel 25, which contains phenyramine maleate, and Phenergan 10, which contains promethazine, are highly effective. They're considered very safe medications to calm those frantic allergic reactions when taken twice a day, as needed. They basically just help turn down the body's sudden overreaction so you can get back to feeling like yourself again.
And for severe nausea and vomiting, Stimatil MD is arguably the safest, absolute fastest acting 5 milligram tablet to halt vomiting right in its tracks. And what's really fascinating about this one is that it also works wonders for motion sickness during pregnancy. If you find yourself getting dizzy and nauseous just from riding in a car, popping one of these before a trip can safely keep your stomach totally settled.
Which brings us to Section 5, high blood pressure control. If blood pressure starts creeping up to unsafe levels, doctors very often turn to Hip Rest 50, which contains the active salt atenolol as their trusted pregnancy-safe choice. By taking just a 50 mg dose twice daily, it gently and safely brings those elevated blood pressure levels right back down to a healthy normal. It's literally a lifesaver for protecting the cardiovascular system during such a demanding time for the body.
Now, it's really important to talk about the rare but potential side effects that are actually shared across almost all of the safe medicines we've just discussed. Even with the absolute safest medications, you might occasionally experience mild diarrhea, stomach pain, nausea, dizziness, or maybe even slight skin rashes. We're highlighting this just to reassure you. While these medications are chosen specifically for their incredibly high safety profile, knowing that a mild headache or a little bit of nausea can occasionally happen is completely normal. It definitely shouldn't cause immediate panic.
And that actually brings us to the absolute golden rule of our entire explainer today. Always give the lowest dose and consult a doctor first. Seriously, no matter how safe a medicine is deemed to be, you must never self-medicate with heavy doses. Always use the lowest effective dose possible to get relief, and never, ever bypass your doctor's expert advice. At the end of the day, your physician is the one who knows your unique health profile best. So, as we wrap things up, I want to leave you with this thought. Empower yourself with this structured information. Take these specific insights, the salt names, the dosage ideas, take all of this directly to your next prenatal appointment. Start building a safe, personalized medical kit that works best for you and your baby. So what do you think? Which of these shelves in our medicine cabinet surprised you the most today? And are you ready to take control of your pregnancy health with your doctor's guidance?